for those who are politically wise, a show about the lives of Christians in Ohio involved with politics. Introducing your host, Reverend Thomas Wise.
Greetings, my fellow patriots, saints, and sinners. The show is titled Politically Wise, and I am your host, Reverend Thomas Wise. At the end of the show, there will be a blessing. Don't miss it. But first, a word from our sponsor. Do you pray for a politician? Do you think a politician can be a Christian? Do you think a politician should stand up for Christian principles? Do you think politicians should pray together? Do you want to see more Christians in politics? If you said yes to any of these questions, please join the Ohio Prayer Caucus Network. Find the Ohio Prayer Caucus Network on Facebook. Welcome back to Politically Wise. The opinions and statements on this show belong to those who give them. The rest of the show belongs to Thomas Wise Words, all rights reserved. The show is titled Politically Wise, and I am your host, Reverend Thomas Wise. Hello, my listeners. This is Reverend Thomas Wise. The show is called Politically Wise. I have a special guest, not a politician. No one's running for office, but would my guest introduce herself to you?
Absolutely. I'm Dr. Amy Anderson. I'm a registered nurse. I've been a registered nurse for 20 years. I hold a Doctor of Nursing practice with a focus in executive leadership from Texas Tech University Health Sciences Center in Lubbock, Texas. And I was a former graduate health policy fellow at the Heritage Foundation last fall. I'm a wife of a fine arts administrator in a local school district and a mother of 4 children, and I currently live in Lubbock, Texas. And I am an associate professor of nursing for graduate programs. I work in the DNP program at Indiana Wesleyan University in Marion, Indiana, where I teach courses and help guide the curriculum for health policy.
Wow, you can do all that from Texas?
I can do all that from Texas. I do get to come to Indiana several times per year and visit with the faculty there and also the doctoral students.
Do you have to come for graduations?
I do come for graduations, yes, 2 a year.
Tell us about your journey, your faith journey.
Sure. I was fortunate and blessed to grow up in a very strong Christian family, a wonderful mom and dad. I also have an older sister, all who are very strong in their Christian faith. And like anyone else, my journey continues to grow, and it has changed over the years. In 2007, our family decided to adopt internationally. This certainly was an adventure of faith and trust and grace, and it brought us our daughter, who is now 7. And I believe this journey changed my faith in tremendous ways, and I'm very grateful for the gift of not only my daughter, or our daughter, but the growth of my faith throughout that process. And I think it's made me be a stronger Christian and really helped my faith.
Wow, I didn't know that you had adopted that. That
yes.
is really something. I've been through that adoption process and raising a child, plus at my own too. So I understand the joys and struggles that comes with that. So
there absolutely are both joys and struggles, but being a parent for biological or adopted children, it's all a wonderful adventure and certainly one that we need to look to Christ for help with. So
how did your faith journey play a role in your current profession?
Sure. I finished a master's degree in about 7 years after finishing my registered nursing license and my bachelor's degree. And I had worked for several years and decided that I needed additional expertise. But what really moved me forward with the health policy piece was after we brought our daughter home, we found that she had a significant health issue that we were not expecting. And we spent numerous hours at hospitals with multiple stays, surgeries, and lots of days in the ICU. And we had a lot of travel associated with her condition to get her to experts that understood what it was she was dealing with and helping her out. Now she's doing great and she's doing well, but that experience living in the hospital, seeing the good, the bad, and the ugly of our healthcare system moved me to find the tools to involve myself in the process of making our healthcare system better. I see policy now, not only health policy, not only from the perspective of analysis and development, but as a nurse and a mother. And I think about legislative impacts on the individuals at the bedside, the patients, the healthcare workers working diligently to care for the patients, the physician trying to make tremendous treatment decisions under immense pressure, insurance companies trying to balance the costs with actual care, And healthcare is just so immensely complex. So I decided that I would go back for my doctorate after my daughter got better and get the necessary expertise to move that message forward of what we were dealing with. And so in that, during my doctorate, I found healthcare policy really spoke to me. It made me I did several different kinds of practicum or clinical opportunities. And when I would go out to different locations, such as the, regional centers for Medicaid and Medicare, and talk to individuals there, I really found that the legislative piece was where the decisions most impacted those of the patient and the bedside healthcare workers. And so that's really why I looked for opportunities in healthcare to make that impact, to help them understand what was happening and how that legislation that they were passing at different levels was impacting the individual. And I happened to start looking for fellowships to get more understanding of the political process and how health policy worked not only in the state and local areas, but also at the federal level, and was applied for and was fortunate to be chosen by the Heritage Foundation as a graduate health policy fellow, and worked there last fall in the Beltway in Washington, D.C. to research and write a paper on the Affordable Care Act, and then to better understand the impact that advocacy has at the federal level.
So are you one of those few people in the world that has actually read the ACA?
Yes, I have read most of it. I'm not going to claim to have read every single line, as it is just such a huge piece of legislation. But I have read a tremendous amount of it and really understand much of what is occurring now and what will continue to occur in the future if we continue with this particular legislation.
So health policy goes all the way from, patient care to the halls of Congress. And so how do you navigate that wide spectrum?
Well, for me being a nurse, my perspective is very much focused on the healthcare worker and the patient. I do look at the resource piece, meaning the finances, economics of healthcare, and understanding that every level of it creates a different change in the environment for which the legislation was created. So at the local level, at the state level, at the federal level, it's all going to be different pieces. Now they're trying to fit all those pieces into the larger puzzle, which is at the federal level. Certainly in this case, the Affordable Care Act is certainly the hot topic right now, of course. And so understanding that large legislation and how it impacts each of those levels, and going back and sort of figuring out how you're going to create policies upon policies to understand what we're supposed to be doing here at the state and local level based upon what was created at the federal level. I hope that makes sense.
Oh, it does. It does. Christian, the guy in the pew needs to know about health policy other than his own immediate needs. When he goes to the doctor, and I'm sure every part of that visit, somewhere along, health policy is guiding and regulating how much of the doctor's time he sees and how much the nurse sees him, and the all that is. Am I right in that thought?
You're absolutely correct in that. At every level, the policy impacts how we interact with patients, how we interact with them from a financial perspective, how we interact with them from a treatment perspective. Not that we're making choices of treatment based upon legislation, but that it influences what we are able and not able to do. From a federal policy level, the Affordable Care Act has implemented numerous regulations on the healthcare workforce. So decisions that are made by those physicians or nurse practitioners or physician's assistants when that patient goes into the doctor may have been influenced by what was done at the federal level. So they're under regulatory requirements. And so when you walk in and you're signing, say, the HIPAA, everybody knows about the HIPAA the Patient Security and Safety Act. The HIPAA requires the physicians to notify you of their practices. So you sign that piece of paper when you walk in the door. That is a regulation from the federal government. So you're going to see those regulations fall into place through your healthcare workers, whether it's your physician or physician's assistant or nurse practitioner. When you go into an office, when you go into a hospital, all that paperwork, the regulations that they're telling you about, Those are requirements. And not only that, now we have specific requirements on insurance companies from a federal level. And so when you're dealing with your insurance company or whether you're on Medicaid or Medicare, obviously there is government involvement in healthcare. So from the general public sitting on the pew, what you need to understand is that as much as we think that we can sit back and not be involved in politics, that without us providing our expertise and our experiences to our legislators, they cannot understand the full impact of the legislation at the federal, state, or local level without voices. So you sitting in the pew at church, you are a voice, and you have the opportunity to share your experience, whether it's good or bad. But that's an important part of being a citizen and sharing that information so that they can make better decisions to help us in the long run.
So the vote matters.
Vote matters.
Yeah.
I know it feels like it doesn't necessarily. Sometimes we feel so removed from what happens within the Beltway, but our vote matters, and I really do think we saw that in the last election process. Is that the vote mattered, and people felt like their vote mattered, and they went out and said, "I feel like we're not going in the right direction here." And so that's how we help change direction, is for voting for individuals to which your beliefs align.
Okay, let me ask this question. This is not in
Sure.
your notes, but this is a scenario that might happen. All right?
Okay.
Say the next president gets elected, whoever that is, him or her. And they go, oh, Dr. Amy Anderson seems like a smart cookie. Let's invite her into the White House. If you go in and you're sitting in there and you get invited into the White House, sit down, you sit on the couch across from the president and say, Amy, how do we fix health care? What would you say?
Well, from my personal perspective on it, I feel like the Affordable Care Act has done much more harm than it has good. And there are going to be people that were positively impacted by the Affordable Care Act. We know that. But my personal beliefs stem from the idea of primum non nocere, meaning do no harm. First, do no harm. And so my biggest concern is that we are harming a tremendous amount of people with the legislation that was put in place. And so I think initially we have to look at repealing, if not all, but portions of the Affordable Care Act so that we're not impacting individuals in a negative way. I believe that we have limited resources, unfortunately. That's the way the world works, and that we have to direct those resources the best way that we can to help those in need. I believe that we need to have price transparency. Individuals need to understand how much it costs to go have an MRI at their local hospital. There's been a lot of hidden information from the consumer, and as a consumer, you can't make a good decision if you do not know how much something costs. And I mean, that's just common thing. You go into Walmart and you go to buy a gallon of milk. You don't take it up there and find out after you've purchased it how much it costs. So I think we need price transparency. We need portability of insurance plans. We need to remove this cookie cutter idea of insurance that the ACA has regulated with the insurance companies and allow people to make choices that work best for them. I'm all about freedom to choose what kind of plan that you want. I believe healthcare savings accounts are essential, and that really will help individuals save money for those experiences that might be catastrophic. And, you know, in moving forward, we should be looking for solutions that are based really on helping the most people and saving those resources for those who truly are in need.
Speaking of resources, are there any good resources out there on the web that Christians could take a look at that you might recommend?
Absolutely. I believe the Heritage Foundation Center for Policy Studies has wonderful resources, great statistics and facts on what is occurring with the Affordable Care Act. The Galen Institute is another wonderful resource for good information, accurate, factual information. The Manhattan Institute is also a great resource. I would look at places like the Christian Medical Association, Catholic Nurses Association, and bioethics centers. There are several Christian universities that have bioethics centers, such as Trinity International, and those have some great information on what is happening from a right of conscience standpoint and just understanding what is occurring in healthcare.
So what's on the horizon, you think, in health policy?
For health policy?
Yeah.
I think right now there's going to be a lot of debate as the new Congress comes into office in January about whether to actually, move forward with attempt at repealing the Affordable Care Act, and also looking at making modifications to the Affordable Care Act in order to not negatively impact citizens of the United States. I think that it is essential that we make changes. If we do not, I believe we're headed down a path that none of us probably want to go, and that with the new high deductibles and co-pays and out-of-pocket expenses that insurance companies are moving towards due to that cookie-cutter insurance plan required by the exchange, that we're going to see more and more people making decisions about their health based upon finances, and that is going to negatively impact our disease and health outcomes.
My premiums doubled. Some people I know, their premiums tripled.
Yes.
That means they have a choice of eating, of having medical procedures, having medical care, or not.
That's correct.
And so we'll see quality of life issues, quality of life going down for people who may not. There's still a massive amount of unemployment in this country, so that affects people barely working two jobs to earn what they barely we're making with one job. So those kind of policies.
And I think from an employer standpoint, you're going to see employers having to drop employees down, and we're seeing that already, down to under the hours that requires them to provide healthcare insurance because they're unable to afford it. And that really negatively impacts the economy and our employment numbers. I think if we could get people back to work and back to jobs that hopefully would provide insurance, that we would see less uninsured, and we would also see people able to afford their health care, right? And certainly we have to address the cost issue. It's almost ironic to me that this piece of legislation is called the Affordable Care Act, when nothing in it addresses affordability or price in any manner, or the cost of health care in general. And so that's something that we're going to need to address as we move forward. We're kind of at a pivotal point here. We're at a point in the Affordable Care Act where the further we move forward with this, with employer mandates, the more we're going to see this impact the individual. And so we're not necessarily seeing as much of an impact as we would probably see in the next 2 years. And I think that the legislation has been written in that manner in order to sort of get you into it, and then you're sort of stuck with what you have. And so I think now is the time to make some significant changes either to it or repeal it, and really focus on creating legislation that helps our Americans afford health care, see the practitioner that they want to see, and purchase the insurance that they want, not some decision that's made from the federal government about what you have to have. Not every health, it's not a one-size-fits-all, and that's what we have right now with the Affordable Care Act. We've really moved to a one-size-fits-all type of insurance, and every individual knows what they need. We're not stupid, as we've been purported to be. We know what we want, and as Americans, our culture is very different from those of Europe and other countries who have socialized systems. We're more independent, and we want to make choices. And so that's, we're limited with the Affordable Care Act.
And we're a little bit more impatient. We won't wait, 6 years for our first surgery.
Right. We don't want to die either while we're waiting. So I guess that's an understandable concern. I mean, people are concerned that that's what will happen. And in some cases, that could be the possibility. And so that's, everybody needs to voice their concerns. I think there's been a lot more vocal in the last year or so about, the concerns with what's happening in Washington, certainly with healthcare. And we need to continue to raise those concerns to our legislators.
So what are some other hot issues that you're working on?
I'm really looking at how the Affordable Care Act impacts the healthcare workforce. We have a workforce shortage in our country. From a healthcare perspective, we don't have enough doctors, nurses, psychiatrists. You name it. Most of the industry is lacking the number of providers that they need. We have scope of practice issues for nurse practitioners to fully participate in care in all states. And we need those practitioners, and we need those physicians' assistants and those physicians to be able to provide quality care and access for patients, especially in rural locations. So that's something that I'm looking at. That is certainly what my paper was about. I'm continuing to look at how changes are occurring, and certainly with the Affordable Care Act. The other part that I'm concerned with and I'm looking into is the right of conscience of healthcare workers. We're seeing tremendous pressure by the administration to participate in activities that might be, outside what our conscience tells us is right. And so we as healthcare workers need to voice our concern, talk to our legislators, and continue to fight for that, for our right of conscience. And so we need to look, and I'm looking in more detail about how that is affecting the individual healthcare worker.
Yeah, I had taken my mother to have a procedure done in a hospital. And as her power of attorney, I was presented with, I just thought would be a simple medical power of attorney. And I was in to give a plan A, plan B, and plan C.
Oh, man.
And so, wow, I just hope I signed the right one for her, because she was in no state to really know. I knew what her general wishes were, but it's that kind of simple, you thought would be a simple little procedure, but whether I had to say, and it wasn't really life-threatening, it just, the way any medical procedure could be life-threatening, and they were just covering themselves to make sure we had the right paperwork together. And so this is even before we even got out of the waiting room. We had to sign all this stuff. So health policy has certainly got very complicated from a consumer point of view.
Absolutely. If you think about just from the healthcare workers' hours of regulation, the reports are saying it's about 190 million hours per year just to keep up with the regulation. And that doesn't consider the initial investment in order to come in line with the Affordable Care Act. So when you think about that, they're taking that and they're having to figure out how to cover themselves from a financial and liability standpoint at the bedside to ensure that they're not being sued later. And that's a very difficult place to be in. And I certainly believe that tort reform would help. I do think that we as a healthcare system tend to treat defensive medicine because we're concerned with liability. And I think that tends to drive the cost up. And so if we could somehow come to the idea that unless it's a negligent act, that most healthcare workers truly are trying to do the right thing and their very best in a situation to help the patient and stop with the frivolous lawsuits, that maybe we wouldn't have to make that choice about plan A, plan B, and plan C when you go in for a simple procedure. And that's an unfortunate part of our system.
In your work here, who has been a mentor for you or some?
Sure.
And what advice would you give to someone following in your footsteps?
Absolutely. Dr. Robert Moffat at the Heritage Foundation and the whole team at the Center for Health Policy Studies at the Heritage Foundation. Nina Orsharenko, Ed Hazelmeyer, Dr. John O'Shea, Eileen Singer. They're all wonderful mentors to me, and I appreciate so much the opportunity to have worked with them. In addition, Dr. Alexia Green, who is a Dean Emeritus and Professor of Nursing at Texas Tech University Health Sciences Center here in Lubbock. She was my faculty member for health policy and encouraged me to move into it. And she's had great influence at the state level here in Texas on workforce issues and nursing education. And so I have to thank all of them for mentoring me into this particular part of the nursing profession and certainly in health policy. And for advice, well, what would I tell people? I would say your expertise is needed. Legislators cannot know everything about every topic that comes across their desk. So they need this expertise from people who understand not only the mechanics or the facts behind it, but also have stories to tell so that they understand how it impacts individuals, maybe individuals that they know or patients or people, family members. That information is essential in decision making, and without experts to share that information, they're lacking the guidance that they need. So get involved and be a part of making those connections with your legislators. They are people too. They are citizens of the United States. They want the best for our country, and that expertise that you can share with them can really help them make those decisions.
Well, we've been talking for quite a while now.
Yes, we have.
Is there anything that you wanted to bring about in this interview that I have not thought to ask you?
I guess for me, I would want to remind our listeners that our government was intended to be of the people, for the people, and by the people. And without our involvement, our nation will not be what we want it to be. The United States is a great nation, and historically other countries have looked to us for guidance and leadership. And we have the opportunity to continue to guide and be that shining light on the hill. So without our ordinary Americans involving themselves at every level of politics, we're going to lose the freedom that many have fought and died for and have come to expect it. And our window for complacency really has ended. The ideologies that have been moved forward in recent years threaten the very fabric of our nation, and we must work to restore the principles of our nation. As Christians, we've been silent too long in politics, and I believe it is time that we speak up. And then I guess the other thing if you would like to read the article that I wrote for the Heritage Foundation, it can be found at heritage.org. And the article is titled The Impact of the Affordable Care Act on the Healthcare Workforce. And I really appreciate the time today, and it was such a pleasure to speak with you.
You gave a number of resources before. Could you give those again?
Absolutely. The Heritage Foundation Center for Policy Studies can be founded at heritage.org. The Galen Institute, the Manhattan Institute, the Christian Medical Association, Catholic Nurses Association, and there are several bioethics centers such as Trinity International.
Well, thank you again. This has been a wonderful...
Thank you so much.
This is Reverend Thomas Wise, and the show is called Politically Wise. The show is titled Politically Wise, and I am your host, Reverend Thomas Wise. If you want to email me, you may do so at politically.wise@gmail.com. Please like us on our Facebook page, Politically Wise.
I pledge allegiance to the flag
of the United States of America
and to the republic
for which it stands,
one nation,
one nation, under God.
America has a rich history of faith.
Without God, there is a coarsening of the society.
We were born with Judeo-Christian beliefs.
The belief that the rights of man come not from the generosity of the state, but from the hand of God.
If we ever forget that we're one nation under God, then we will be a nation gone under.
We must protect religious liberties for all men. That's how we make sure that this country is not dismantled by those folks that want to completely eradicate God from our history and from our future.
We're seeing things that were unimaginable right here in the Capitol, literally erasing the word God from the structures here.
We need this kind of revival of people turning back to God.
It's not a Republican or a Democrat thing.
In God we trust. It's an American thing. Join us and publicly display this motto.
In God we trust.
Join thousands of Americans in the Million Window campaign and declare our national motto, In God We Trust.
It's our duty and responsibility to join together and unite.
One of the best things people can do is realize they can make a difference.
We are one nation under God.
Go to InGodWeTrust.com today. Order your decal and display it proudly.
Let's again write In God We Trust on our buildings, in our classrooms, to combat the anti-God dismantling of our nation.
Say it and display it. In God We Trust.
Do you pray for a politician? Do you think a politician can be a Christian? Do you think a politician should stand up for Christian principles? Do you think politicians should pray together? Do you want to see more Christians in politics? If you said yes to any of these questions, please join the Ohio Prayer Caucus Network. Find the Ohio Prayer Caucus Network on Facebook. Welcome back to Politically Wise. The show is titled Politically Wise, and I am your host, Reverend Thomas Wise. Thank you for listening today. If you want to email me, you may do so at politically.wise@gmail.com. Please like us on our Facebook page, Politically Wise. Now, here's your blessing. Blessings based on Psalms chapter 24, verses 1 through 5. The one who blesses you claims the earth and everything in it. The one who blesses you claims the whole world and those who live on it. Seek the Lord and be blessed. Find the Lord and be vindicated. Those who seek God's face are blessed by the God of Jacob. Seek, fine, and rejoice in the Lord.